and today we'll be doing the T-Lab PRF treatment to the tear trough. So we'll be using our prepared PRF kits that come with everything in them. They come with the stand that we can put our vacutainers into, 2 PRX tubes, our straight needle, all the syringes and needles that you will need for your treatment, and the 25 gauge cannula. So we'll begin the treatment by taking blood. First we attach the tourniquet to the patient's arm and tighten it up. We're only taking 1 tube for this treatment, as we're only doing the tear troughs. Elco wipe the area. We are using a straight needle with our vacutainer to take the blood with. Little scratch. Release the tourniquet, gently rock the tube, and then remove your needle. So because we only took 1 tube of blood, we are going to use our balance tube, which we have filled with water, and we do want them to be around the same level. So we'll place them into the centrifuge across from each other to keep the centrifuge balanced. We want to keep our RPMs at 2000, so we'll hit our speed and reduce that down to 2000 RPM. And we'll keep it at 4 minutes, and then we just press start. So while our blood is in the centrifuge, we prepare our sterile kit. So we open our sterile kit and place all of the other instruments that came in our pack onto our kit. So we place our 3 ml syringe, our 25 gauge cannula, and our needle and our drawing up needle. We also will need some chlorhexidine into our dressing pack. And we also need to make sure our patient is prepared for treatment. So we will be cleaning his area with chlorhexidine and alcohol, and then following with the chlorhexidine wipe as well. So we remove our PRF tube from our centrifuge. You will only have a very small amount of PRF to use. On average, it's about 2 mils per tube that we have for each treatment. We do have to make sure that the tube is devac'd before we put our needle and syringe on, and we use the green needle to do this. You don't want the needle all the way into the liquid, just so that it has devac'd the container. We then place our 19 gauge needle onto our 2 mil syringe, and that is what we use to draw up the PRF. So you want to ensure that the needle is just in the PRF and then you're not drawing up the red cells. So on average, you get about 2 mils. With David, we've only gotten 1.5. So I will just divide that 1.5 up per tear trough. I will then attach my 25 gauge cannula to my syringe. I have primed my cannula. I will cleanse the area with chlorhexidine and alcohol wipe first, followed by chlorhexidine after. I then use my pilot entry point to make an entry point to the lateral canthal area so that I can place my cannula and go directly across to inner canthus. I always pinch the skin up, and this allows me to pinch the skin away from any vessels to minimize any chance of bruising. I leave my pilot in just for a few seconds just so I can make sure that no blood comes back. I want to be at a depth of 1 to 2 millimeters, which is where the fibroblasts sit that we're trying to stimulate to produce collagen. So this is not a deep injection. It's at about that level with the cannula, and we're running from inner canthus to lateral canthus in a retrograde thread, and then we will do the lower part of the tear trough area, and the lateral part. So there is mild swelling, which is normal. We never inject more than 1 ml per tear trough. So again, just running underneath at that depth of 1 to 2 millimeters. So we do want to be quite superficial. And lower tear trough area. And lateral canthal area. So after the treatment, we do apply bepanthen to the area that we have treated, and just in a thin layer. We don't massage the area at all. We do leave it alone and let the swelling go. We actually want the swelling to happen because then we know the treatment is working. It is stimulating the body to attract more growth factors and more platelets to the area that we have just treated. We also want to ensure that our patient doesn't take any anti-inflammatory medications, prednisone, aspirin, as these can affect how well the treatment works. We also ask them to minimize exercise for 24 to 48 hours, avoid alcohol for 24 hours, don't rub the area. I always get patients to put a clean pillowcase on after all treatments, just to reduce the chance of any infection. Thank you for watching this T-Lab PRF tear trough treatment training video.